Good morning, Miami. Welcome to another show of Wonder Women. This is Yolanda Carvajal. I have the pleasure to introduce you to the health expert ladies. They are wonderful ladies I was presented to by Janet, my friend from Happy Hearts. And I would love to introduce you to them. I probably will make a mistake with the names because I always do, but this is
Yahoska
Perez.
Yes.
And
Katy Robles.
Thank you for being here with me today. I really appreciate it.
Thank you for the invite. Yeah.
I'm very excited to talk to you about what you ladies do. I think it's very important what you guys are doing. So they educate, they sell insurance, but they educate the senior population regarding insurances. So, but first, let's talk about a little bit about yourselves. And can you share, are you native from Miami?
Yes, I am. I was born and raised here. My roots are Nicaraguan and Peruvian.
I was born in Colombia, Cartagena. Came to Miami when I was 10 years old.
Wow. Do you guys love Miami or?
Yes. Sometimes we dream.
It's a melting pot.
It's the most beautiful melting pot ever, right?
We say like, let's move. And then we're like, no, we're staying here.
We're staying.
There's nothing like Miami.
When we come from an airplane ride and we see our Miami, we're like,
skyline.
Home.
And then we go straight to the Cuban coffee. Right?
Exactly.
Because there's not like it.
Exactly. So when we were talking a little bit earlier, you told me you guys came from AvMed.
Yes. We worked there for 9 years together.
Great insurance.
Yeah. And so we worked there 9 years. We started as temps, so never in the world did we imagine that we were going to be here. But we just liked it. We just liked talking to the seniors, explaining benefits, and just helping them understand what they're entitled to. You know, what they work so hard to receive.
And it's so hard because there's so many insurance companies, right?
Yes.
So directing them to the proper insurance company is crucial for them. And I know you teach them. So why don't you share a little bit of what you're doing, how to teach them regarding their insurances?
So yes, right now we're hosting monthly events, educational events at different locations with the city of Cutler Bay, Pinecrest, coming soon Homestead, Kendall, Aventura, and hopefully Broward County as well. So, we're making our way little by little. So educational events of what the things that they need to look for this upcoming enrollment period, how to differentiate based on the needs that they have, what the right plan is for them.
So let's talk about a little bit about the enrollment period. I think it's very important because I've been in the medical field forever and it's changed so much. So when does enrollment start?
So officially it begins October 15th through December 7th. And then from October 1st to the 14th is what we call the research period. So it's when benefits are released.
Oh, okay.
So that we already start talking to the clients, letting them know what's happening. But officially it's October 15th through the 7th. Yeah.
So normally when the insurance come, up, there's changes, right? Like usual changes. So what are some of those changes that happen in the plans?
Yeah, so changes in costs, co-pays that they're responsible
that's right.
for, pruning of providers. The network itself does change, not just now but throughout the year.
Right.
And then benefits in general over that. The reduced dental can be reduced or completely removed. Vision,
Transportation,
and the most
really
important
big
one
issue right now with transportation.
Yes, and also the food benefits that are provided.
Oh, really? There's food benefits provided.
Yes, some plans provide supplemental food cards for members that have chronic conditions, and also the dual members, which are Medicare and Medicaid recipients.
Wow.
Yep.
So I also know that, if I'm not mistaken, please correct me if I'm wrong. Medicare covers a certain percentage, and then the other percentage it's covered by another insurance company. You need a supplement, correct?
So there's two types. You can get a supplement, which is a private insurance, and it comes with a premium, a hefty premium that most people can't afford. And then you have the Medicare Advantage, which are basically the all-in-one, all-inclusive. There's here in Miami, we have no premiums for the most part. And they include everything: hospital, medical, dental, vision, transportation, OTC, food cards. So those are the most popular plans that at least we see with our clients here in Miami-Dade and Broward. And that helps fill that gap that you're saying.
Right.
So
That big gap.
so a lot of the co-payments are no cost or very limited cost. And the good thing is that they have a maximum out of pocket.
Okay.
You know, so there's a protection for them that
Do
definitely
they have
helps
a
them.
deductible as well?
Not for in the Medicare Advantage. If you stay with original Medicare or supplement, yes. There's a deductible for the hospital and the
And this
medical.
is where teaching comes so important, right?
Yes. Mm-hmm.
So what are the questions when you have these events that they ask you? What are the main questions that they have?
Really, it comes down to their doctors, right? That's
Their
the most
needs.
I
important thing.
understand that.
Yeah. So is my doctor still going to take this plan? Is the hospital in network? And then I would follow up by medication, which is a big deal too.
100%.
A lot of the brand names are they're unattainable, you know, too expensive for them, or they're just not being covered.
Got it.
So those really would be the two main questions that we're getting at these events.
And you're covering many areas, so which you're dedicating yourself to a certain population of that area, right? And in that area, there's different hospitals,
Correct.
and they don't even know if those hospitals are covered, right? If they have major surgery. I imagine if they come for like, I don't know, emergency, they'll take care of them,
Absolutely.
right? And then they'll transport, once they're stable, they transport them, but they don't even know if they're walking into a place that their insurance is
That's where
covering.
most of the confusion comes, right? Especially with the Medicare Advantage or the supplement, right? What are my rights? What are my benefits? And that's where we come in and kind of like clear those confusions for them. And there's a lot of chatter and noise from, well, my uncle has this and my mom has that, and well, I want that, but you know, everybody has different needs.
It takes time to figure this out.
Absolutely. And to add what you said, I think that's the biggest confusion, that they want the benefits that their neighbor has, but then it's not going to cover your doctors.
Right, your primary doctor.
Exactly.
Right.
Your primary specialist, or your drugs are not going to be covered, but you want the no referrals. So we conduct a needs analysis. You know, we get the list of their medications, the list of their doctor, and then we have a conversation. We say what's important.
You need to know what's going on with them too.
Exactly.
Yeah.
Which is hard.
It's hard.
Yeah. Absolutely, especially when we talk to so many people, but it's very important, you know, that we do that so we can guide them to the correct plan. Yeah.
And you have sponsors, I heard.
We do.
You have a wonderful commissioner.
Yes.
I've only met him once, and he does wonderful things for his community.
He really does. Yes. Roberto J. Gonzalez, the District 11, he's been amazing. We've known him for a really long time. And we told them what we're doing, and really, we don't feel like we sell insurance. We're really here to educate and
That's the
just
word,
help.
educate.
Yeah, yeah. So when we told them what we do and how we go to different communities, he invited us to a Mother's Day event for one of his senior.
One of the senior centers that he
And then
part of,
and then there we were able to meet you know, different people for Parks and Recreation, and that's where we started the Social Fridays at Westwind
Which
Lakes.
I love to talk about that. You're kind of like Janet regarding the birthday parties.
Parties
Which is why how we met.
It was like perfect.
Yes. So
Same idea, but different group.
there you go.
Correct.
And so he's been amazing. His office has been amazing, and
Supportive.
they're supportive. They come to the events, and you know, they'll set up a table, and you know, they'll talk to the people. So
Which they'll listen.
They love him so
They
much.
do. Oh, man. And when he's not there, oh man, they're like, where is he? ¿Dónde está? Yeah, I know.
No, but it's beautiful to see what he's accomplished, and you know, talking to him, I know that the seniors like you, it's very important, you know, to him, and yeah, he's done a fantastic job. And
The senior community, I think it's overlooked,
absolutely,
and they have so much need. And right now, the way the economy is going, every little penny counts. We're not even talking about $1 anymore.
Yeah.
I say penny.
Yep.
Because they're so limited with what they get a month, right? Even if they had a wonderful career and have retired with a great check, it sometimes doesn't cover all their expenses.
yes,
Right? So
Yeah, when
every
you're
little bit helps.
yeah, when you're in a fixed income, and we see this a lot, right? And that's one of the reasons why we decided to go independent and be able to represent multiple companies, because one plan doesn't fit for you, for me, for my neighbor, right? So having that conversation and being in front of the senior and telling me, well, I only get $800 a month from those $800,
Son $800.
you know, like
Nothing.
I have to pay for my drugs. I can't pay extra costs on seeing a doctor, being hospitalized. And that's where kind of like our knowledge comes in and tells them, well, these are your options. You know, you might lose your doctor, but you're going to get everything covered and you have your check that you will not have to touch, right? So we kind of help them fill those gaps and see what's available for them.
And, you know, something I have to say, you're giving them that space to talk freely, not to be embarrassed.
Yeah.
Absolutely. And we keep that relationship, you know, we love what we do. So they'll call us.
Because it's a secret, you know?
Yeah. They'll call us just to say like, hey, you know, my Medicaid got approved and thank you so much. Or today's my granddaughter's birthday. Here's a picture. Like they send us pictures. They become like our family. Yeah, absolutely. And yeah, giving them the space to talk. Absolutely.
Do you help them with the Medicaid process? Like
we do.
If once, let's say they can't pay that 20%, do you help them with that Medicaid process?
Yeah, there's different avenues that we have to help them apply for Medicaid. If it's through one of our partnered carriers, insurance companies, they do have dedicated departments that can help them do that application process either over the phone or send them the application. Because a lot of them don't have a computer, they don't have a phone, or they don't know how to work a phone, you know. So that, we do have, you know, access agents that are licensed to, or not licensed, they're certified, that's the word. They're certified to be able to do applications for Medicaid, and we'll connect them with those people.
How many agents do you have in your office? I know you've been growing, so let's share.
So we're so proud, but we have 25 now.
Congratulations.
Thank you.
Good for you.
It started just us two in 2019. We met just
6 years. You passed that 5 years, that big 5 years, and look where you're at today.
So it's funny because everybody asks how we've been able to stay working together, right, for so long, but we've known each other since
sophomore year, so 20 years.
Yeah.
Sisters.
Yes.
Pretty much.
Yeah.
She comes to our family events. We go on vacations together with our girls. And so I always joke because sometimes I'll see her like at my cousin's party and I was like, you were invited? Like I didn't even know because they don't ask me. They just text her. She is my sister.
So my partner, Laura, she's my kid's second mom. Like they were like,
it's the same.
You're my mom. If I can't get a hold of my mom, I'm gonna get a hold of you, Laura.
And that's very special.
Yeah, and it's important. It's very important to have that, continue that family value in your business, right? Which you're all doing. So I know your husband also helps you out. You mentioned a little while ago. Yes.
Well, because of all this, you know, I was talking to him one day, like at one of the parks that we work with, they shared a story with us that they had a sponsor that was feeding 120 seniors every day.
Wow.
Unfortunately, their budget got cut, and now they can only feed 60. And the ladies that worked there, Mariela, Hi. They were so saddened by this, and they're telling me the story with tears in their eyes. And I said, no, we have to do something. I just stayed in shock, you know. And she told me, we are in America, and you're telling me that we can't feed 120 seniors. So I talked to my husband about it, and I said, you know, sometimes it's hard because companies see us as sales agent, you know, so they may not want to work with us. So we came up with this idea. It's the golden year. So we're almost done finalizing all the paperwork.
Almost there. And
that's how I met Janet, because Emily Zuby introduced us, and she said, talk to this woman. She's wonderful.
She is.
And we're kind of doing the same thing, like you said, in different, you know, demographics. So what we want to do is sponsor more birthday parties, more bingos, more arts and crafts, anything. And then from a nonprofit, we know we'll be able to get more accomplished than from the insurance salesy side.
Very important. Yeah. Very important because, you know, they still want to live. They want to celebrate their birthday, and you're putting them all together.
Oh, my goodness.
No, they love it.
I think the first time that we were doing it, we were like, oh, okay, we're just going to bring the cake and, you know, the music. The second month, we've been at Cutler Bay for 1.5 years now. Every month our team is there. And I think it was the second month that we were there. A lady got up and she said, my husband died 6 years ago, so I haven't celebrated my birthday in over 6 years. So she came to thank me saying, this is the first time in 6 years that I'm celebrating it in a big group. And like, it really touched me.
It does.
Yeah.
And they come up to us. Thank you for being here every time we're there.
Yeah.
Thank you for being here. You know, thank you for being so consistent. You know, it makes a huge difference in their day.
I think one of the things I've noticed, us Latins or we celebrate our birthdays, And
We're just talking about that. Yeah.
and when you don't have that anymore, I mean, it really is sad, and it's a day of life, It's a day that you came to this world, and it should be celebrated. At least with a friend, but you're doing it in a group, which is a party setting, and I know they love to dance. That's
Oh
for
my
sure.
gosh. Yes,
You could skip the cake as long as you give them a DJ.
And that's exactly what we do at Westwind Lakes. So we're partnering up, with different clinics, and we're bringing a DJ. And these people, grupo,
They don't stop dancing.
Sit.
No.
Like our feet are hurting.
And they
We're
bring
like,
us up. They're like,
"Oh
ven a
my
bailar. Like, why are you
I've
here?
never seen so much energy. An hour and a half, and they don't sit.
So no
We love
heels.
them.
We always have to go in flats or sneakers.
Sneakers,
because
yeah.
It's not.
They're
yeah.
wonderful. It brings joy to all of us, and them, all of us.
So
Yeah.
tell me your schedule. Like, what days are you where? Because there's so many. And I saw one of your Insta, and you said, no, we have 10. And I'm like, 10 in 1 week, 10 in 1 day. How do you manage it? How do you do all of it?
We have never done as many events as we're doing right now. But there's changes in the industry that pushed us to be out there more. So,
Which I want to talk about those changes a little bit.
so we're from Miami to Broward, and we're starting in West Palm, and it really depends. So this week we had none, but next week we have 3. So I think we've done about 10 in total. We just booked like 3 more
And webinars
tomorrow.
too.
Oh, and we do monthly,
For the
2
ones
times
that
a month.
cannot, yeah, for the ones that can't make it or they're in another county, we
And
have
your
webinars.
caregivers probably call you as well.
Yes.
Absolutely. And some of the caregivers actually are coming to our events,
Wow.
right, to learn about the changes. So our schedule's never ending.
Yeah. Especially now during the enrollment period, this is the time to be busy, especially with all the changes that are going on.
So tell me a little bit of the changes that are going on.
So there are several health insurance companies that are reducing plans available in certain service area. They're completely going out of the area. They're not providing the Medicare plan at all.
So they're removing themselves from Medicare.
They're removing themselves from Medicare. So statistically, I think I saw it online that it was 2.5 million Americans nationwide that are going to be affected with all the changes that are happening from the
Seniors,
major
imagine.
from the major carriers. Prescription plans are not going to be available. The premiums are going to go up on the prescription plan. So it's a combination of so many different things that are happening this enrollment period that we haven't seen in the last 10 years. A lot of disruptions.
Wow.
Katie, I want to say since we started, we've been doing this for 15 years, and I don't think we've ever seen such a
Drastic.
So many
change.
factors
such an
happening at the same
exodus, too.
time.
So I
Yeah.
remember
A lot
last
of
year was the
things.
transportation.
Some of
Yes.
the plans cut
Cut
those
the
or reduce
Transportation,
them.
yeah.
So the questions to really ask, I think, is when they call their insurance company, if they can't get a hold of someone over there, and they could call you.
Absolutely.
In my insurance plan? What are they cutting on my insurance plan? Right.
Right.
That's like the main question.
Yeah.
If to keep that insurance or probably change to another one
Mm-hmm.
that has the benefits that you need. Right.
And that's what we're saying in our seminars, because what we've noticed is through the years, if you like your plan, you're going to stay put.
Right.
Like, oh, I'm having the best experience, but this
The
year,
elderly doesn't like to change. They're
No.
exactly.
At all.
They
But
like their
this year, they
custom.
can't do that. They shouldn't. And that's what we're advising in our seminars. Whether you work with us or your broker, you need to check your plan, because doctors, like Katie was saying, doctors are being dropped or they're deciding to leave. Medications may not be covered. Transportation may be reduced. So this year, more than ever, they have to review their 2026 benefits. Yeah.
So how long do they have to be able to make these changes? Like, I know there's a starting period, but there's also an ending period, correct?
Yes. So the enrollment period officially starts October 15th, ends December 7th. But for those plans that have a termination, that they're leaving the service area or the plans are being removed completely, they have what is called a special enrollment period, which runs to the end of December. So they technically have until the end of December, and then all the way until the end of February if the plan doesn't work out, like a trial period, and they want to look for something else. Yeah.
And what about if someone is just going into Medicare for the first time? Can you teach me a little bit or educate me a little bit about how that process works now? Because I know there's changes in that process as well.
So it depends on the person. Like, our first question would be, are you receiving Social Security benefits yet? And we don't need to know the amount. But the reason why we ask that is because if they are receiving Social Security benefits, then they can skip the step of applying for Medicare. and a lot of them don't know they have to apply,
Okay.
or they apply
I'm
before.
learning so much.
Oh gosh, we could be here all day.
So much information.
I'm learning so much.
Some people stay working. You know, they're not going to retire at 65. They stay working till 70.
They have dependents on the
That's
policy, so
right.
they
That's
can't
right.
leave,
Right.
you know, because
I
they have
get
the
it.
wife, the
Yeah.
'Cause I
son.
know a lot of people that want to continue working,
Yeah.
but they're able to get their Medicare somehow.
And a lot of, because they age, they reach their age.
Right.
But the biggest confusion that we've seen is that people think that they have to get Medicare even though they're working. So they're
They're going to get
paying
penalized.
because they're going to get penalized. And that's not true. So we see a lot of people that are double paying. They're paying for their Medicare because Medicare is not free, everybody. That's another
Misconception.
Oh my gosh. And when we tell them that they have to pay for Medicare, it's really tough. But
I didn't know that either.
yeah, a lot of people don't know that. It's
I
not
thought
free.
once you hit 65 or 67,
you
Medicare.
still have to pay.
You have to
I
pay.
thought they took it out of your like Social Security or something.
It's $185 this year, and unfortunately, that's going up to $206 next year. So $206 being removed from your Social Security income. Yep.
That's a lot.
Yeah. So going back to the new to Medicare, that's basically where we start. Are you collecting yet? Yes. Okay, you don't have to apply. They enroll you automatically. If you're not collecting, then we'll send you the information on how you have to apply for Medicare. And then from there, we do our needs analysis and do our thing. Yeah.
Wow.
But that's the main question. Yeah. To apply or not.
And is everything by computer? And when they apply, how does that work? Like,
There's
they just call
different
you
avenues.
or
Yeah, there's different options. So they can try to do it online. It's getting more and more
that's what I
tough,
was bringing up.
right? With the
'Cause it's
security
hu-
questions and
Right.
a lot of them. Well, you have the baby boomers that are more tech savvy, right?
But we're
But
talking
still-
about the ones that haven't gotten there yet.
Correct. So technological wise is a little bit, challenging, but they can always call and schedule an appointment with Social Security and go in person. Again,
Which takes long to.
takes long for them to pick
that
up and
tells you
schedule an
need to call them.
appointment. Yeah.
You have to call these young ladies.
You know, I want to mention that in one of the libraries that we're working with, I think it's once Tuesday a month, and it's the Hammocks Library. There's a team, I don't remember their name right now, but all they do is help seniors apply for Medicare. And since they're not licensed agents, they can do that. And that's at the Hammocks Library. The Hammocks. But yeah, which is great because, it's complicated.
It is complicated, I think, with the new technology and now with all this AI.
Oh my goodness, yeah.
It's moving faster than we could learn. At least for me, it's even hard for me. So I cannot imagine an elderly person that knows a little bit. All this new, send me this code, send me that code, and then you get a person on the phone, and it's not really a person; it's an AI.
Yeah, so
it's
much
very frustrating.
Lots
for
of
them.
scam and fraud we've been seeing too. So it's very scary for them to try to do anything on their own.
And unfortunately, they're the first population that falls for the scams the fastest. Then, me, you, and then, our kids. But yeah, they're very susceptible to all that's going on. And it's sad. Yeah.
So if someone wants to get a hold of you, follow up with you, I know they could go to the events, but is there a phone number?
Sure, of course.
Your contact information.
So our cell phones, I think, are on our website. But if they want to call the 1-800 number, it's 800-380-6821. And then we're on Facebook and Instagram. But yeah, our personal phone numbers are there, so they
your
can reach
Instagram.
us.
What's your Instagram?
It's at Health EXPS INS. It's funny because we were talking about that yesterday with some of the agents. Are like Health Exps. The domain was taken. I'm like, guys, the domain was taken. But yeah, I think it's Health Experts INS for insurance. Yeah.
And you can message there, and
Yes.
Absolutely.
especially the caregivers are communicating so much now through
Facebook. We get a
Facebook,
lot
a lot through
Facebook.
Facebook.
Yeah.
And through our website,
But
too.
the elderly love the Facebook.
They do.
Yes, more than
Yeah.
Instagram.
Yes.
Yes.
Caregivers like Insta.
Yes.
The elderly like
Facebook.
Facebook.
Yeah.
So that's a great way
We're
of
very active on Facebook.
They message us a lot.
I
They're
bet.
very
Yeah,
vocal.
vocal.
They're not shy, which is great. We reply to everybody. And then if you see, back there, you have our website through our chat. We get a lot of messages that way too.
And I want to repeat the locations again where you're going to be at. So can you repeat those
Yes.
again?
So next week we are at a frozen yogurt shop.
Oh, frozen yogurt. I saw that.
Yeah.
That was so nice of
Con
them.
helado. We're trying
Un
to do
poquito de
Spanish.
helado. Un un poquito de helado doesn't hurt. You said.
Exactly. So we
A
are.
little bit of ice cream doesn't hurt.
We're off. I think
Never.
it's 117 and Sunsets. We're at TJ Maxx, sorry,
yeah.
Plaza. So that one's in Spanish. And then we also have the Kendall Library, the Hammocks Library,
Yeah.
on Thursday for coffee and conversation. And then we got to tell you what happened with Cafecito. So we had to change it to coffee and conversation. And then in the afternoon at 3:00, we're at Cutler Bay doing an ice cream social. We have un carrito. They're going to come and do their ice cream, whatever you want, all the toppings.
Qué rico.
Yeah.
So you give them something to eat?
While getting some educational information.
We do have diabetic friendly options, because we got in trouble. But we're like, yes, you're right. So we try to
Cafecito sin
accommodate.
azúcar.
Exactly. There you go.
No sugar with cafecito. And the ice cream, sugar free.
Sugar free.
Yeah.
And we just booked Hollandale Beach Library. So if they go
That's
to,
nice. So Hollandale is growing a lot in that area. And I think they're lacking a lot in many ways. I think that's a great area that you guys just went there.
we were asked through Facebook, actually,
Wow.
Yeah.
if we can go there.
Yes.
And we said yes. We've met so many people through these seminars. And like Katie was saying, not only do they come and thank us, but they'll invite us.
And they'll connect us to other people
Yeah,
to
which
bring
has
the
been
talk
great.
to, which is
Yeah,
amazing.
it's been great.
I think we don't realize how big the elderly community is.
Mm-hmm.
And you think it's everything is covered, but it isn't. Really, Miami, that one's
We're pretty lucky.
lucky there.
Yeah.
But when you go to other communities up,
Absolutely.
like in Broward, Hollandale, it's lacking a little bit of information, right?
Absolutely.
And I think, we need to get more involved in those areas because there's not enough information. There's a lot of questions and you don't even realize it. That area is full of, a strong elderly population in the Hollandale area,
Yes.
especially in the beach area.
Yep.
And what we've noticed too is a lack of Spanish language
That's the other
events.
I agree.
So we both speak Spanish, thankfully. So we are trying to bring more awareness and doing more in Spanish. So we're going to have, I think it's early October at the library of 152nd and 88th Kendale Library. So we're doing English and Spanish. First English, then Spanish. So if anyone wants us in Spanish, let us know. We have presentations in Spanish and most of our team members speak Spanish.
Yeah. Bilingual.
Very important.
Yes.
Especially here in South Florida,
Yeah.
Miami, you have to.
And even if they speak English and they speak it fine, sometimes they understand things better in their native language, right?
Correct.
Yeah.
Yeah. And we don't see enough of the Spanish outreach. So we're trying to change that.
That's awesome.
Mm-hmm.
You guys are doing a great job.
Thank
Thank
you.
you.
Your family
so
should be
much.
very proud of you.
Oh, thanks.
Thank you so much.
I always like to ask this question, being ladies, women, and what advice do you give future women entrepreneur who want to open their own business? What advice would you give them?
I would say just to keep on going, keep on pushing, not to give up. You're gonna have a lot of hurdles, that you're gonna say, I'm done, I'm over this. But those are the times that, you're gonna reflect and say, okay, I have to keep on moving forward,
Yeah. And I would say to that, like not being afraid to ask for help.
That's a
And
great one.
we wanted to do this alone for so long. We didn't want anyone to come and tell us what to do. And then we were actually at a lunch with Emily Zubi and Nati Diaz. She said something that stuck with me. She said, I was at a point in my career that if I didn't ask for help, I was going to,
Yeah.
So I told Katie, okay, we need help because there's so much to do and only us two, we
weren't even scratching the surface at that point. Yeah.
So we have a partner now and they've been amazing, but we're still us. We do our own thing. They just help us with like marketing,
and support in general.
Yeah, which
Hey, you can't do it all.
yeah,
Like
so
we were talking, communication,
yeah,
text, Instagram, Facebook,
It's a lot.
email,
It adds up.
mail.
yeah.
I mean,
Yeah, like little things, but
it's a lot.
Yeah.
It's a lot.
It's a
You
lot.
need help.
Absolutely,
And so basically, don't be scared to ask for help,
yes,
Nope.
yeah,
right?
Mhm.
and don't stop and don't give up and
Keep moving
keep
forward.
moving forward.
I mean, great example. You started at AvMed.
Yeah.
You got your background there.
yes,
You move forward. You saw a need.
Mhm.
And then the next step. And then that probably was going great. And then you figure out another need.
right.
So you're constantly changing, which is
yes.
why you're here. That's why you're so successful, because you didn't stay with one way of doing things. You
Correct.
open the horizons and try different avenues to get to where you need. And from 5 to 20, 25, you said?
25,
Yeah,
I think now.
25.
Yes, yes.
That's amazing.
And and what you're saying, like changing technology.
Yeah.
Evolving
The
with technology,
webinars,
yeah.
we didn't know they were going to be successful. We thought, like maybe the elderly don't want to. Yes, they do.
They do.
Yes, they do. Instagram, Facebook ads, all that, it really helps. Definitely.
Thank you for being here with me today.
Thank you
for
having
Thank you
us.
so
I
much.
covered everything.
Yes, and more. Thank you.
Pretty much. Yeah. Go to our website. All the events will be
Yes.
there every day. We're adding more.
For sure I want to go to one of those events.
Come to the
love,
cafecito.
I love dancing with them. I love the elderly. I was raised by my 2 great-grandmothers and my 2 grandmothers.
Oh, nice.
Y mi tía abuela, which is your, I don't know how you say that in English, aunt?
Tía abuela.
I know what you mean. We know
abuela,
what the abuela,
but-
yeah.
I was raised by them and I learned so much by them. I mean, I am who I am today because of them.
Mm-hmm.
Grandmas are so important and grandpas, right?
Yep.
Yes.
So,
The
and they have
backbone.
so much wisdom. We don't give them the credit of how much wisdom they have. I bet you're there and they give you.
You don't pay
so-
attention. You don't.
And they tell
they
you
share their
Yeah.
stories.
and
Yes.
you learn from them, right?
Yes. Yes.
It's so
absolutely.
beautiful. I
It
think
is.
what you guys are doing is great. Thank you so much for
Thank
bringing
you.
this to our community.
Of
That's
course.
so much needed. And I wish you only the best. A lot of blessings.
Thank you.
lot of blessings.
Thank you.
Thank you guys for being with me today. This is another wonderful Wonder Women. I'm so proud of them. This is so much needed. And I want to thank my community newspaper, the Miller family, for letting me have this wonderful podcast of Wonder Women, bringing more awareness to wonderful women that are doing great things in their community. And like I always end my show, don't give up on hope and always believe. Have a blessed day, guys. Bye-bye.